Welcome to another episode of the Empowered Fertility podcast, the place where we dive deep into all things fertility. I'm Dr. Brenna Squires, a clinical psychologist and fertility support coach, here to bring you the knowledge, resources, and expert insights you need to feel confident along your journey to parenthood. So let's get started. Welcome to another episode of the Empowered Fertility podcast. Today, we are going over the very unique topic of organ movement. We will also tie this into how organ movement impacts our health and our overall fertility. Here to speak with us today is expert Dr. Missy. Dr. Missy Albrecht is a doctor of physical therapy and the owner of Invincible in Lakewood, Colorado. She has been practicing for over 11 years to help men and women improve movement in their entire body through manual therapy and other tools to help them reach optimal wellness. So welcome, Dr. Missy.
Thank you, Brenna. I'm so excited to be here.
I am so excited to hear more about this because, like I said, this is such a unique topic. I don't know if anybody's ever heard about this, but before we get into that, do you mind sharing how you got started into organ movement and physical therapy?
Definitely. And I think the cool piece with this is my story and how I got into it. And just as myself and Dr. Brenna sit here, our organs are in perpetual motion, and that's what makes the body healthy. But we never really think of movement coming from the organs. We always think of, surgery or medicine or something like that. So I'm very passionate about talking about this topic. And so I had some really intense health issues coming out of college. They diagnosed me with chronic fatigue syndrome, went through all of these nutrition adventures. I actually found a functional medicine provider back in 2007, which is wild. Cleaned up my diet and did all the supplements and stuff like that, but was having really bad back pain when I went into traditional physical therapy school. And we had a professor who, I went up for every demo and they tried all the orthopedic treatment for lower back pain. But he had done some training in what's called visceral manipulation. So it's gentle manipulation of the organs to improve movement. And he was able to get rid of my back pain by working on my intestines. So it was just this mind-blowing period where it was like, I can't believe our organs actually have to move. And how can my intestine refer pain to my back? So it just led me down this journey of, I just knew I had to study organ movement because what a cool way to help people who can't get rid of pain.
Yes, and I mean, as you're sharing that, I'm so thankful that you went down this path because you wouldn't be here today helping other people.
Yep.
And I'm sorry that you had to go through that, but I'm also thankful that you met somebody that taught you this strategy. And so do you mind telling us a little bit more about visceral movement and what that it's all about?
Yeah. So visceral manipulation is a term coined by Jean-Pierre Barral. He's an osteopath out in France. And so he is kind of the founder of this work. And there's a few other institutes now that are teaching this manual technique. But the foundation of the Barral Institute is to be gentle and specific. And so we hear the word manipulation and we think of a chiropractic adjustment. So some people will call it visceral mobility to try to make it sound more gentle, but in the end it's visceral and then vascular and neural manipulation. So including the blood vessels and the nerves. And it's a very gentle approach to improve movement to help optimize physiologic function.
So is it like a massage, or are you pushing organs in certain places or something different?
Yeah, so it's a very specific massage, if we want to call it that, but it's more about creating space because it is a hands-on technique, and we work through the rib cage, on the abdomen, in the cranium, pelvic floor. But it's about creating space around the organ and then allowing our amazing bodies to do the healing and the movement on their own. And so a good example is the small intestines. So we've got all these tubes sitting right in front of our around our belly button, but they have this attachment to the spine. And so if we have a restriction in that attachment to the spine, it can present as lower back pain, it can present
Mm.
as bloating in the intestines. And so I'm not necessarily taking the small intestines and putting them where they belong. It's more about making sure that they can move and all kind of settle into place with our breath, with our heartbeat, our cranial sacral rhythm, to kind of get that homeostasis again.
And creating space is I guess the key to be able to allow them to move with all of that?
Correct. Yeah. So the movement piece, so like I said at the beginning, our organs as we sit here are in perpetual motion. So they're moving with our diaphragm as we inhale and exhale. They're also moving in it's a embryologic, so how we developed in utero a rhythm that, so if these were your kidneys here, they move towards the spine and away from the spine in a
Hmm.
certain rhythm without the breath and without us doing anything. But then as we start to move our body, as I'm doing, let's say, a forward fold in yoga, my small intestines also have to be able to move for my spine to move. So those are kind of the basics of the organ movement and where we can start to see dysfunction if they're not moving well.
Yes, and can you share a little bit more about the pain? Because I can see how that would work if you don't have the space in in your body and you're trying to, let's do, like you said, do the bend over for yoga or do stretches. And if you don't have space, I can see how that could contribute to pain. Can you share a little bit more about the pain aspect of it? Like you had said that you were feeling pain and it wasn't until they moved it that you had pain relief.
Yeah, so the pain can come from, so if we go back to the small intestine example in the spine, this is the lumbar spine, the lower vertebrae. The attachment of the small intestine to that area of the spine is normal. So it's designed to kind of move away and then come back depending
Mhm.
on what we're doing, where we are in the digestive process. But if it doesn't move, we can get pain by those segments of our spine not moving, and maybe other areas move more repetitively than they should. But we can also get nerve irritation. So we've got so many nerves intertwined within the organ system around the pelvis, around the spine. And so some people, my large intestine restriction was so close to the lumbar nerve roots coming out of there. And so if I get digestive discomfort, even today, I can feel that back pain, and now I kind of know how to, it's usually from gluten. So that's kind of a common area, that lower right intestine. But the pain can come from the compression of the surrounding nerves and blood vessels. It can also come within the organ being inflamed or irritated.
Wow. So a couple of different reasons why you could be experiencing pain, but pain, I guess, just lets you know that there's something. Again, pain in general lets you know that something is off. And
Yeah.
in this situation, it sounds like it lets you know that there's not enough space to allow the organs to move.
Yeah, because they're so, we're all connected and everything is so integral with, if we look at the hip joint, when I bring my knee up towards my chest, my intestines need to be able to get out of the way to move. My
Yeah.
kidneys need to be able to move along the hip flexor muscle to allow for that motion. And so we know how to kind of manipulate the joint and stretch the muscles and strengthen the muscles, but what about these deeper structures that are causing movement restrictions that are it's not like you're going to look at your hip and say, oh, that must be my kidney. You kind of need this skilled assessment to be able to see your, someone might have restriction in their kidney,
Yeah.
but they're not necessarily having kidney pain or bladder issues or anything like that. So it doesn't always
Yeah.
present in an organ fashion.
Yeah, can you tell us a little bit more about that with like you just said, it doesn't always present with those some symptoms like with kidney issues, but can you tell us some of the other symptoms that you could recognize that you're having some issues with or organ placement or organ movement aside from like lower back pain or digestive issues?
Yeah, so that's a great question. So I believe in this work so much now that I feel like everyone would benefit from kind of like your dentist check in twice a year, because the way that organs lose movement can come from a variety of different things. So we can have inflammation, food allergies, surgery in the abdomen. We can have a fall on the tailbone or a car accident. So any type of impact to the body puts the organ system into this whiplash trauma that it holds on
Uh-huh.
to. Any emotional trauma can also cause the organs to lose movement. And so anytime I hear someone who has had, a hit to the head, car accident, contact sports, digestive history, constipation, fertility struggles, period, PMS, long COVID, all of these little things they stack up over the years, and our body is so dang good at adapting, but it gets to a point where it's like I have no more room to adapt.
Yeah.
So coming in to see someone who does this work, the evaluation process, sometimes if we go back to the small intestine example, maybe that person is struggling with fertility, but we have to undo tension in their lungs from asthma when they were a kiddo first. So
Mm.
the body kind of walks us through, where can I work today that's going to make the most change in the body? And sometimes it even comes back to cranial tension in the head.
Wow.
Um, so even we're oftentimes explaining to patients, we may not work the area that you're complaining about today. We just have to listen to the body and work through, and eventually we'll get to that relief, hopefully.
And it sounds like that's what's so important with that initial assessment to be able to see
Correct.
what's going on.
Yep. Correct. So, and what we do during that assessment, so I'm a trained physical therapist, so I have some of my physical therapist tests that we do, but we do something that we call listening. And so we place our hands on top of the patient's head. And in osteopathy, there is a belief that the body hugs the lesion. So the body might be holding this tension in a specific area. And with a trained hand, we can feel in general where that is. And that helps fine tune where we're going to go for the day.
That is so interesting. The body hugs the lesion. And I know you had just said that it sounds like the biggest things that you're looking for if there's any physical or emotional trauma or physical or emotional issue, which can be everybody, which is why everybody should probably do this.
Mhm.
And if the body hugs the lesion, the body hugs where the problem is. It sounds like as you're touching the body, it has a tense feeling. Is that it?
It tends to be a line of tension. And so a good
Okay.
example is a healthy cell has a negative charge. So if we think of like charges in a battery, and an unhealthy cell like cancer has a positive charge. And so our hands in their healthy state are being attracted like magnets to
Mm,
that unhealthy area. And
mhm.
so it gets to the point where we touch someone's head and everything feels pretty good. And that's when we say, okay, come back for your, 6-month checkup, or if you get sick or go through a round of antibiotics or an accident or something like that.
That's so interesting. It makes me wonder what happens when there's inflammation throughout the body. So what is your perspective on inflammation and how it impacts the body and organ movement?
Yeah, I think what's really cool about that is someone could have inflammation in various areas of their body, and they're going to also have various lines of tension. But through our evaluation process, we are trained to be able to, let's say I felt Dr. Brenna's head and you had tension in your right sinus, your liver, and your uterus. There's a way that we can prioritize which one needs to be worked on first. Because again, I
Hmm.
could work, let's say it was your sinuses first. If I work the sinuses, that could help the liver because there's a connection between the liver and the sinuses. And
Really?
so if I can get rid of the liver tension by just working that one area, I'm going to prioritize that area.
This sounds so interesting. It
Yes.
sounds so interesting. I'm more fascinated about how are you figuring all of this out by touching the head or I mean, are you just touching the head and that's how you figured that out?
Yeah, so it's full hand contact and we won't go into like the science of, but we have different like
Yeah.
receptors in our
Okay.
hands. And I would actually encourage you and the listeners, you can start to play with it's either the like meaty part of our palm underneath the thumb or the pinky side. And if you have, let's say you have a scar on your arm or your leg, you can start to practice feeling where the scar is not and where the scar is. And where the scar is, it will start to pull you in. It's really fascinating. And so
Oh,
that's kind of a nice way, whether you're going to get into the work or not. It's just kind of proof of concept. So
yeah.
now when I touch a living thing, it's like really hard for my poor dog is like, please get your hands off of me. Because you just start to become more and more sensitive. I like to compare it to a sommelier and their ability to drink wine and know exactly where the grape is, where
Mm,
it's from, what year. So we just
wow.
start to get really specific.
Well, it sounds like you get very attuned to that specific thing and you're almost hypersensitive in a way to
Hmm.
the feeling of what it feels like. It reminds me of when the stories that you hear when people are learning about um how to identify a real $100 bill versus a fake and you study it so much by the time you are done studying what a real $100 bill looks like you see a fake and you could just say fake fake and it's not magic it's just you've studied it so intently and it
So
sounds like that you
much.
studied this specific thing so intently you know when something's off versus when it's working properly.
Yeah, 100%. And it's a ton of anatomy studying.
Hmm.
And sometimes I'm with a patient and I'm in an area that's like, what I don't like, what is this? And I'll go back and look, or I'll look with the patient. I'm like, I need to really check because when you look at like an anatomy book, there's so much detail.
Hmm.
Um, but I like that $100 bill example. That's perfect.
Yeah. And you also mentioned emotional. Let's talk a little bit more about how emotions are stored in the body and what happens when they get stuck and what does that look like?
Yeah. So there's some alignment with Chinese medicine with some of these osteopathic beliefs around the emotional pieces. And John Pierre Barral has just started to see these themes with like each organ stores a certain type of emotion. So
Mm,
the kidneys can be fear, the lungs are grief, small intestine is a little bit more family oriented. And so we all tend to have a natural pattern
mm,
of our emotional experiences and how we store them. But if I go through a really traumatic family event and so family would be small intestines, if I already have a history of SIBO, maybe some lower back pain, and my small intestine is not moving well, the emotions aren't going to be able to pass through the body and out like
mm,
we would want them to. So that's kind of what they're designed for. So uh, the belief is that if you're just so overwhelmed, either from prior physical tension or just the emotional experience is just too much for the body and the brain to handle, the
mhm,
body will
mm,
store the emotion and it'll become physical tension in the organ. Um, and so actually a lot of times we'll have conversations with patients who have worked with someone like yourself. They've done kind of the talk piece.
mhm,
Um, and then we'll do some treatment and they come back and they're like, I don't know why I thought I worked through this family issue. Why is this coming up? And it's like,
Yeah.
you probably have done some really awesome work, but your body was still holding that memory. So we're just helping the body release and let go. So try to hold space for your body and journal and use your tools and yeah.
Yeah, it reminds me of conscious and subconscious when with talk therapy and any other kind of therapy where you are processing something out loud or just processing something with journaling. It's all of the things that are in your conscious awareness that it's bothering you, and that's why you're trying to work through something. But it sounds like what you're doing goes to that deeper level into the subconscious, to where your body's holding on to something else, and you might not be fully aware of it because you've probably suppressed it or something else.
Hmm.
And it sounds like that's what you do will help release it, is one way to help
Yes.
release it.
Correct. It's one of the pieces because we also will see people who've never done the talk piece. And so we
Oh,
encourage, this is a really important piece. That's not something that's in our scope of practice. So we need to
yeah.
bring someone else on the team to do that. And what's really cool, so this year, I'm diving into the brain curriculum. And so how we can actually address areas of the brain that are also holding
Nice.
those tension patterns. So what they talk about in the brain classes is we can't get rid of that experience for the
Mhm.
person. So we're not going to remove that experience because there probably was, especially there was a lot of probably positives that they learned from it, but we're going to help the body lighten the load. And so they're
Okay.
not carrying around this heavy, they compared it to like a heavy backpack that you're carrying around. How can we lessen that tension in the body?
And does anybody, I mean, I have a couple of questions with that. But
Yeah.
the first one is, does anybody ever get very emotional, like when you're doing this visceral manipulation and you're working at this deep level? Does anybody start crying or getting very emotional during these sessions or after?
Yes, yes. And so we will typically on the first session have that conversation. If
Mhm.
emotions come up, do you have any tools to handle them? Sometimes as they're getting to know us, it takes a little bit to open up and cry in that moment. But we're constantly watching the body
Mhm.
in response to the treatment. And so if someone's holding their breath or if they need a moment, just to kind of ground, we'll use breathing, we'll use nervous system techniques, essential oils, something like that. But yeah, there's emotions that will come up. There's also memories. I remember
Mm.
working on someone's pancreas one time, and the guy shared after that he went through this whole memory of driving in the car with his parents. And so just kind of looking at it with curiosity to see maybe that's how his body needed to let that tension go.
Oh, that's so fascinating. The body is so fascinating.
Yes,
And
it's
how it
amazing.
has things that are at the forefront of our mind, and also when it stores things. I think it's so interesting to hear about stories that when you release those stored emotions, what comes up.
Mhm. Yes. We have to be no single patient experience is the same. So
No,
just trying to hold space and love for those people. The body teaches us a lot.
it definitely does. Definitely. Can we talk a little bit more about how this pertains to fertility? Because fertility, in and of itself, can be a stressful journey full of grief and anger and frustration. But if you think about it, that's just part of the journey, because they probably had other physical and emotional distress prior to that. And so, how does this treatment approach help
Yeah.
with someone who's going
Yeah.
through fertility challenges?
Yeah. So I like to say that we work with people throughout the entire motherhood journey, whether you're
Mm.
preconception and just struggling with your period or your kiddos are
Mhm.
40 years old and you're postpartum. There's still things that we can help with. And so when we look at, it's always really nice to get people in that preconception phase just because we have, I mean, as you know, the fertility process can be very stressful. There's a timeline. Um, but when we catch people in the preconception, we can have, multiple sessions to really undo these layers of tension and
Mm,
normalize their cycle and improve egg health. And same thing goes with the man, being able to help with sperm health and blood flow to the pelvis. Um,
mm,
and so a lot of times, again, no picture looks the same. It could be nowhere near the pelvis, but oftentimes when we look at fertility challenges, there tends to be a history of digestive issues. And I think what's tricky with that is someone will have, been constipated their entire childhood, and they've worked with the functional medicine and they've cleaned up their labs and their bowel movements are moving again. So everything digestively seems good,
mhm,
but there's still remaining tension
mm,
in, let's say, the end of the colon, compressing the uterus or pressing on a fallopian tube or ovary, possibly altering that ability to conceive. And so
mm,
that's because a lot of times when the inflammation is old, we're still going to have that organ movement loss. And so being able to improve, I mean, just think of how important blood flow is to the
mhm.
whole fertility process, whether
Yeah.
it's egg or sperm or implantation. Um, and even IVF, the ability to accept that and have that develop into a fetus. That blood flow is just so important. And so, again, if that history of constipation is a common one that we'll see, um, so we get them moving, and we don't promise anything, but we see what their amazing body does with that space in the pelvis.
Yes, and when you said the constipation and with the tension, are you able to notice that there's tension in in that area? Let's say if they are taking laxatives or if they're doing a coffee enema or something like that, do they still experience that tension, or do you still notice that some people might still have the tension even if they are flowing but not flowing naturally, so to speak?
Correct. Yeah, that's a great point. Like if they're still using, like if I think everyone kind of needs magnesium, but if they're super dependent on magnesium to
Mhm.
have that bowel movement, what else? Like when I look away, I'm like thinking of the human anatomy, but like
Yeah.
the covering around the colon and how that connects to the front of the abdominal muscles and where that line of tension could be
Mm.
elsewhere, even though things are moving through the tube well, what about the outside and how it's connected to the tailbone and maybe a fall in the tailbone? So there's so many, I
Yeah.
like to call them Pinocchio strings that could be crisscrossed that we need to
Yeah.
unwind.
Yeah, and that's a good point. And that's why I wanted to ask that question, was because if somebody is taking something or doing something to almost make the body work
Hmm.
properly, it
Yep.
sounds like that will help one area and it might make it seem like everything is fine, but
Hmm.
there's still hidden tension, maybe stored emotions in that area that could be considered problematic.
Correct. Correct. And I think
Wow.
the other piece of it too, if even if the person isn't struggling with fertility necessarily, if you have, let's say you had a fall to the tailbone and you have this line of tension on the left side of your pelvis from that, as the fetus is developing, they may not have as much space to
Mm,
grow because there could be this kind of crowding in that side of the pelvis. And so, how can we not only optimize fertility, but optimize the growth of that baby and
wow.
make labor and delivery a little bit smoother for mom and recovery as well?
Wow, that was gonna be my next question. So it sounds like you're able to do that during pregnancy to allow more movement to allow that baby to grow.
Correct. Yes. And so
Wow.
there are certain techniques and areas that we don't work on during pregnancy or if someone thinks they are pregnant.
Mhm.
Um, But even, if someone comes in and they're pregnant, sometimes I will work like their stomach or their diaphragm to help create more space for the baby to grow. And then we'll do a little bit more postpartum if we haven't had that many sessions to help kind of work through some potential uterine tension that was there.
Yeah. Wow. And it sounds like, again, it's all very hands-on. So you need to see your patients in office. This is not something that you can do online kind of through the screen, right?
No, not yet. And I think touch has been lost in the medical world quite a bit. And so
Mhm.
it's so healing. We do have some ways that we work with people virtually and teach
Okay.
them self-care stuff.
Oh, neat.
But in the end, we try to help them find someone that does this work near them as well. Cause you can't, they miss the evaluation piece. We end up kind of chasing the symptom or based on experience, like, well, we think you should work here, but we
Mm.
don't know truly in their body what they need.
Wow, that's fascinating.
Yeah.
It makes me want to go investigate this further. And so for someone like myself who has listened to all that you've been saying and they think I want to go try this, what is a list, let's say a checklist of something that they should be looking for in a physician that does this practice?
Yeah. So essentially, you just need a license to touch in order to take these classes. So they're postgraduate school courses. So you could see a massage therapist, acupuncturist, DO, chiropractor, PT. Um, but the Baral Institute, where I've done most of my training, has um, a find a therapist link, so you can look
Okay.
people up and see where they are and what their practice is all about. And I can actually share that link with you so we can let listeners know. The
Yes.
one thing we're starting to see after many years of doing this is there are some organ movement techniques out there that are pretty aggressive
Hmm.
and uncomfortable.
Wow.
Um, and what I actually learned recently is my friend went and found a provider on the institute and it was aggressive. It was just like a little bit more uncomfortable.
Hmm.
And so just that reminder of, as we're learning this work, especially coming from a PT, I'm taught to have very heavy hands on muscles and joints. And so there was a learning curve going to these gentler structures.
Yeah.
So the Baral Institute teaches gentle, but it may take that provider, they may need that feedback like, hey, this is actually pretty uncomfortable. Is this supposed to be uncomfortable? No, it's not. Thank you for telling me. We're going to kind of tweak this.
Hmm.
um, but some of these other trainings just have the belief of we're going to grab your stomach and we're just going to move it around.
Oh my gosh.
um, and I've taken some of those classes and I have found them to be very uncomfortable and not as productive. So
Yeah.
I don't want to bash the other trainings per se, but we have just found that the gentle and specific approach is we're actually listening to the body. So if I'm
Hmm.
holding the stomach, I can feel where the body wants the stomach to go to unwind rather than tell the stomach, hey, you need to go here and then you need to go here. So
And I would agree with you with I want the gentle approach.
yes.
If somebody did that aggressive manipulation, I don't I think right now I probably would speak up and say, "Hey, this is hurting. Is this supposed to hurt?"
Yes, yes.
But I think some people it might throw them off altogether. Is there a gentle way that we can ask the provider whether or not they do gentle versus aggressive touch? I mean, we don't want to say aggressive, but is there a nice way of saying, "How do you do this?"
I think that's a good question. I think asking the clinic or the provider, should I expect for this to hurt,
Okay.
is a like safe way,
Mhm.
and see how they respond to that, because there is such a, I grew up in athletics and there's such a like rally through pain. We can't heal
Yes.
without something being intense. And this work is not not designed for that, the organ system. Because if we're reproducing pain, the body probably isn't going to feel safe to let go.
Yeah.
So that I think that would be a safe, if someone asked me that, I would feel I would feel comfortable, and then just speaking up in the moment. I had a
Mhm,
patient last night who was like, "Ooh, that's really uncomfortable." And I'm like, "Thank you for telling me. We're gonna go somewhere else." And that wasn't even I was still very light, but
mhm,
she had just, come back from the ER and had a bunch of gut inflammation,
mm,
and so her body in that moment was not ready to
yeah.
receive that work.
Yeah. If your body's a little bit more sensitive, even light touch can feel like a heavy pressure.
Yeah, so we're gonna work elsewhere. Yeah.
Yes. Yes, and that's a really good question to be able to ask so that we don't seem like we're being aggressive trying to figure out if they're aggressive.
Yeah.
And and it's good to always speak up. And that's something that I work on with my clients a lot and having that being able to use your voice and advocate for what you want and advocate for how you're feeling because it's not supposed to be I like how you said it's not supposed to be painful because your body won't release pain if it's still feeling pain.
Yes, exactly. And I again, I relate to those people. I've been in those situations in like a massage or something, and I'm like, "Ooh, this
Mm,
does not feel right." And it can be hard to speak up.
yeah.
But just knowing that you speaking up, even if that provider doesn't seem receptive in the moment, it's going to help them either take a different path or become a better provider, in my opinion.
Yes, I agree. I agree, and even if and if at the end of that it doesn't feel like it's working or it's not helpful, would you recommend that they go seek another provider or try something different?
I would seek another provider and feel free to reach out to us. We have quite a big network of, we've got people listed on our Google map that we
Oh,
have
cool.
kind of vetted over the years. Um, but in general, I would say most of the time people come in and see our team or someone else that we've referred them to, and they're like, half the time it feels like you're doing nothing, but I can feel the difference.
Yeah.
So, we have this they'll tell their partners, "I'm going to my voodoo doctor." I don't know what she's doing, but she's doing it. So most of it should feel relaxing. People take naps. It's very calming to the nervous system. That should be
Wow.
the expectation.
And thank you for sharing that's the expectation because I think part of you thinks if it's too tense, then we want it more gentle, but we don't really think about what if it feels like nothing's happening? What if it
Yes.
feels like you're
Yeah.
just sitting there and you're doing nothing, and then you just paid, I don't know how much for this appointment where nothing happened, but then
Yep.
afterwards you feel better.
Yes. Yes. It's because it's so gentle, and I'm sure you've worked with many people who are not super in tune to their body, and that's not a requirement to receive this work, but the biggest thing you may feel after 7 sessions is more relaxed, and I call that a win. Even if you don't feel like some of our patients are like, "Ooh, I just felt my lower back release," or I feel like I can breathe better. You can start to kind of get in tune to some of those things, or they'll leave and we'll get a poop emoji from them because they had a bowel movement.
Yeah.
Yeah, or
And
a
I
baby notice.
that is awesome. That was gonna be one of my next questions, is what are some common things that people feel like they achieve or that they get out of this? So you named a couple where their lower back might be feeling better, they might feel more relaxed, they might be able to have a normal bowel movement. Anything else that they can expect?
Yeah, so if they came in with reflux, we're hoping to lessen that. Um, the period normalizing their cycle, less PMS, less cramping. Um, what are some other things? More mobility in their joints. So we work with a lot of athletes that struggle to squat in a deep position. So, they've stretched their hips for years, and all of a sudden, like, wow, it's actually holding. All this joint mobility work that I've been doing is finally sticking. And it's like, well, great, because you're pooping every day.
Well, also you've made space, and when we were discussing this earlier on in the episode, when you make space, it makes it easier to
Hmm.
do things because you have more
Yes.
room.
Correct. Correct. Space is
Awesome.
good.
That is what's that?
Space is good.
Space is good. Yes.
Yes.
And as we come to a close with this episode, I am just wondering if you have any final thoughts before we end.
Yeah, I think, speaking to most of the people that are going to be listening to this, whether they're struggling with a fertility journey or their partner is, we come across a lot of people who are so stacked with so many different appointments. And so sometimes it
Mm,
feels overwhelming to do one more thing. And
mm,
so I like to encourage people to honor that. If we
mm,
get one session in with someone before IVF implantation, that's great. Like, one is better than none.
mhm.
But just really being able to sit and breathe and maybe go try one session and see, like, yes, this feels like the right path, or maybe it doesn't. But just really listening to that intuition, because we never like to promise anything, but we're always very curious if we get the organs moving, maybe that fertility, that conception is going to be a little bit smoother.
Yes, that's wonderful. That's wonderful. Thank you so much. And thank you so much for sharing. I have learned so
Yeah.
much. And I bet listeners out there are going to want a follow up episode or more information about this because it's so interesting and nobody really talks about this. And so thank you so much for sharing all of your knowledge and your experience with us.
Heck yeah. Thank you for sharing your platform and your mission. And I think there's just a lot of things out there that we can help people with. So information is good.
Yes. Space is
Yes.
good and information is good.
Yes.
Awesome.
Yes.
And thank you so much, listeners. I really appreciate you taking your time to listen to this episode. If you have any questions, feel free to put it in the comment section. And if you have any other ideas for other topics that you want to listen to, also put that in the comment section. And we will see you next time. Thank you so much for joining me today on the Empowered Fertility Podcast. If you're looking for personalized support on your journey, whether that's through therapy or coaching, please reach out. Just complete the contact form linked in the show notes, and someone from my team will be in touch with next steps. Remember, you are not alone. You are not broken, and your story is not over. See you in the next episode.